Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University. I'm pleased to provide this week's update, 21st, 2021. I'm going to do something a little different this week and hopefully in future weeks, and that is instead of just giving you a litany of numbers, I'm going to try to pose and answer four questions. Every week, I'll answer the question, how is the pandemic progressing globally in the U.S. and in our region? This week, I'll add the questions, what is the importance of the new variants of SARS-CoV-2? What are we learning about long-haul COVID-19? And can President Biden really do anything differently to control COVID-19? In terms of the pandemic globally, we've now passed 2 million deaths worldwide and almost 100 million cases, 5.2% increase in the past week, which is discouraging because, again, in September and October, we were running in 3.5% to 4% weekly increase. It looked like we were dropping down into the low fours again, but now we've picked back up again. We'll have to wait and see. But if 5.2% week-to-week increase continues, we'd expect to get to 3 million deaths in about 2 months. In terms of where the cases are located, early on they were in China. Then in the green, you can see a large explosion in Europe. Then over the summer, very few cases in Europe, but a lot of cases in the Americas. And now the last couple of months, Europe and the Americas together. In the US, we're seeing this progressive growth, but now we've passed 400,000 deaths. And you can see this inflection point in early November when it started to get a little bit steeper. We've had 22,000 deaths just last week alone and a 6% week-to-week increase. So again, a higher percent increase in the U.S. and in the world, which is telling us the pandemic here is growing faster than in the rest of the world. Again, this is discouraging because we had seen a drop in the percent week-to-week growth rate, and then it seemed to pick back up. I was hoping we were seeing it drop back down, but we're not. If this rate continues, we'll get to 500,000 deaths by February 11th. In terms of where all the states are, you can pause the graph. At this point, there's Tennessee right there at 1,177 deaths per million, just slightly below the U.S. rate overall. You can see on this map where all the cases have been. And again, you see this clustering east of the Rockies. I don't quite know what to make of that, as well as here in the western part of the South. 2 weeks, we're seeing a continuation of this outbreak in California and Arizona, a clustering here in the middle part of the states, and now an increase in cases in the eastern part as well. If you look at our region for the first time in a couple of months, we're not among the hardest hit parts in the country. If you look at the 4 states that make up our region, the 5 states, you can see pretty significant difference in the number of deaths. But oddly, South Carolina and Tennessee have about 50% more deaths per million than the rest of the region. And we'll leave that for discussion on another day. In terms of ballot health's 21 county service area, there have been 1,384 deaths, a 6.2% increase in the past week. So growing about the same rate as the U.S. overall. And if this rate continues, we'll get to 2,000 deaths in about 6 weeks. So that's the status of the pandemic globally in the U.S. and in our region. You all have heard a lot about these new variants. There have been cases of new variations reported in the United Kingdom, the Republic of South Africa, Brazil, California, Florida, and other places. And this may be why we're seeing a resurgence in cases and deaths. For those of you who've been following these presentations of mine for a while, we've been commenting on the fact that in Europe, we saw this spike in March and April and virtually no cases in the summer, and then this explosion in the late fall. And one of the possible explanations for that is a variant in the virus. Something new is happening. Now, we don't know for sure that that's what it is, but that's certainly one possible explanation. The new variants appear to be more transmissible, but may or may not be more lethal. Fortunately, at least to this point, it looks like the vaccines will be effective. And of course, more importantly, we know that masking, social distancing, avoiding crowds, and other approaches will be just as effective. I think probably what we're seeing with these new variants is what we see with flu every year. You know that every year you have to get a different flu shot. That's because the flu virus mutates and it varies over time. And I suspect we are seeing, or will continue to see that same kind of thing with SARS-CoV-2. It may well be that these vaccinations that everyone's getting now will have to be repeated at some point in the future with a more accurate vaccine. We hope that's move on, but the fact that the virus is mutating fairly quickly is a worrisome sign. We also have learned a lot more about this, what we call long haul COVID-19. And these are chronic symptoms that appear to be common, especially but not always in those who are hospitalized. They don't always appear to be related to the severity of the illness. And there are a variety of symptoms that are being attributed to this so-called long haul neuropsychiatric syndrome, like symptoms like brain fog and depression, tiredness, exercise intolerance, joint pain, chest pain, shortness of breath, a cough. We don't know why this is happening. Some have hypothesized that it may be an autoimmune phenomenon, something that we're developing. It may be experiential in the sense of being in the ICU or the hospital, or even just having a disease that could be fatal, can have long-term neuropsychiatric complications, or it could be direct injury. We know that if you lose your sense of taste and smell, there's something going on in your central nervous system. If you're coughing, you've got a fever, we know there's something going on in your lungs. And it may be that there's direct injury. And as Tony Fauci says, it's a phenomenon that is quite real and quite extensive. So something we have to pay attention to. And finally, a question that everyone's asking is, can President Biden really do anything different to control COVID-19? We all want to rush to say yes, but let's be honest. No one knows absolutely for sure precisely how the future of this virus is going to pan out. But I think there are some things that the president can do. And public acknowledgement of the severity of the disease. We know that early on, President Trump chose to downplay the importance of the pandemic. In retrospect, it was explained that he did that to avoid public panic. That may or may not be the case, but nonetheless, it's very clear that people who followed President Trump downplayed the importance of the pandemic and were reluctant to engage in the kind of activities like masking and social distancing that we know make a difference. So certainly publicly acknowledging the severity of the pandemic is an important step that the new administration can take. Widespread education about masking, social distance, avoiding crowds, of course, has to continue. Obviously, further assistance with development and distribution of vaccines. But there's some other steps I think need to happen. And one of the ones I think we've failed on so far is we really need to push rapid tests, something that can be used all over so that folks know very quickly whether they're infected and need to quarantine or isolate. Obviously, we need to re-engage with global efforts to control the pandemic. Pandemics, by definition, affect multiple countries. All of us are interdependent. We could get 100% vaccination here, but if the virus mutates somewhere else and it comes back into the States, we're back in the same boat. So clearly we have to collaborate nationally. Obviously, we want to depoliticize public health. If someone had told me 3 or 4 years ago that wearing masks would be considered a political statement, I would have been unsure how to react. But the reality is public health by definition is not political. We are not liberal, we are not conservative, we're not right, we're not left, we're not Democratic, we're not Republican. Public health is about what we as a society can do to assure the conditions for all of us to be healthy. That is not a political statement. And importantly, one of the things that absolutely has to happen, after decades of underfunding, we have got to refund state and local public health. If we don't do that, we're going to be in the same boat the next time the next virus hits. So my 4 questions this week: how is the pandemic progressing? What's the importance of the new variants? What are we learning about long haul? And can the new administration do anything different? There's a great deal more information about COVID-19 on the College of Public Health website. If you enjoy these videos or you share them with other people, please let us know, and we'd like to add other folks to our listserv so that more folks have a chance to see them. I'd like to thank Dara Young for editing, producing, and posting this video. And as always, if you have any questions, comments, concerns, you'd like to see a topic that I could address in the future, please let me know. I look forward to hearing from you. Thank you very much.